I want to provide a quick update on COVID-19. Yesterday, the Department of Public Health reported more than 20,662 new individuals were tested by molecular tests, which doubles the number of tests completed from the day before, and 542 of those returned as positive. Massachusetts continues to be a national leader in COVID-19 testing, and yesterday we announced the extension of the state's Stop the Spread campaign through the end of October. The 7-day average for the statewide positive test rate remains at 0.8%. 361 patients are currently hospitalized, and 71 of those are in the ICU. Our metrics continue to be encouraging, and other states are taking notice. Yesterday, Maine removed Massachusetts residents from its list of out-of-state travelers required to quarantine or produce a negative test. And I'm really bummed that Jonathan's not here to hear me say that, because he asked me about it a couple of million times. Our administration continues to update our statewide COVID-19 risk map, which shows detailed community-level spread based on population and highlights which communities are considered high risk or red. As of last night, 15 communities were classified as high risk, and 13 communities moved from moderate to lower risk status. The state's community enforcement and intervention team will continue to work with these higher risk communities, and it's imperative that residents of higher risk communities remain alert and responsible while we all work together to mitigate the spread in their communities. As everybody knows, last Wednesday was the first day of school for nearly 1 million public school students across Massachusetts. Getting back into the classroom was no easy task for students, families, teachers, staff, school officials, and administrators, but for some districts, there remains work to be done. People have done a phenomenal job here in Massachusetts to bring our transmission rates down. And communities with the lowest risk categories on the COVID risk map, so-called gray and green, are experiencing little to no transmission of the virus. Communities and school officials should monitor 3 weeks' worth of COVID-19 public health data when considering learning model plans to make decisions based on trends rather than a response based on any one recent large gathering or party, which may spike people's data for 1 week. The state's contact tracing program is equipped with the necessary tools and resources to monitor, identify, and quarantine any potential spread. And the science supports this. It's safe for these students and teachers to return to in-person learning, and our administration is clear in our expectation that students should be in the classroom if the public health data supports that. Our plan has been developed and endorsed by Massachusetts pediatricians, and we work closely with experts from our public health department as we developed it. And for most communities and districts, students and teachers are back in school in either hybrid or in-person education models, and we think we are off to a fine start. Today we had the pleasure of spending some time with educators in Quincy who've been teaching kids in person since the summer and have truly done an incredible job. They've had mostly a positive experience, and I commend them for their efforts and their ability to support their kids. Quincy Public Schools was one of the first in the state to reopen this past summer, offering in-person learning to hundreds of students with disabilities and special needs. Additionally, they stood up an optional remote learning summer school attended by more than 2,300 Quincy students across all grade levels. They're an excellent model of how to safely and responsibly get back to school using DESE's guidance. Their faculty and their staff expertly tackled the safe reopening of their schools, overcoming challenges along the way, including 2 staff COVID-19 positive cases over the summer. Quincy school officials and staff should be commended for their effective response, which ensured that in-person education was able to continue for hundreds of students with special needs. In many ways, teachers are heroes to these kids and to their families, and they play a critically important role to teach and nurture our students, and they often go far beyond their job description for the sake of every child. And special education teachers and staff in particular, day in and day out, rise above what is asked of them. They dedicate their time, their lives, and hearts to the healthy growth and development of those kids, and for that, our administration is incredibly grateful. I've said before from this podium that we get lots of mail online and the old-fashioned snail mail way. But some of the most potent and powerful and poignant mail we've gotten has come from the parents of children with special needs, for whom the lack of in-person teaching had a profound impact, not just on their child's further development, but on their child's ability to sustain the success and the progress that they had made to date. And those letters and emails typically come with a significant plea for the return to in-person education. And on this one, I want to thank Quincy especially for basically never dropping the ball and finding a way to continue to offer that service throughout the course of the summer. Superintendent Mulvey, Assistant Superintendent Perkins, you and your team have done a terrific job, and I really appreciate your being here today.